Welcome to a conversation with world-renowned plastic surgeon Dr. Richard W. Fleming. Today, he's going to answer the important question, how do you choose a plastic surgeon for your rhinoplasty?
Choosing your surgeon before your rhinoplasty operation is the most difficult decision for any patient, or for any of us. First of all, obviously you want your surgeon to be board certified. But beyond that, especially in rhinoplasty surgery, you want to select a board certified surgeon who truly specializes in a few procedures, obviously one of them being rhinoplasty. I don't want a surgeon who specializes in breast surgery or liposuction to be doing my nose. Third, what you really need to do is find out if your surgeon is on the faculty of local medical schools. That's also a great recommendation. Get recommendations from medical societies, from those very medical schools in your area, from physicians that you know and trust. In my practice, I have many physicians and their families as patients. So in my community, if you ask physicians about my practice, they'll be very aware of what I am doing. So that's very beneficial when you're trying to select a surgeon. Select a surgeon who answers all of your questions, thoroughly discusses alternatives. See your physician's work. When I do revision surgery on patients who've had their rhinoplasty done elsewhere, many times the results aren't bad, but the patient didn't get what they want because they didn't discuss up front what was going to be done or not going to be changed. There's a lot of choices. So make sure you see a lot of before and after pictures. Make sure that your surgeon's aesthetics are in concert with yours. It's important that you have alternatives explained because there's many different ways to reach the same end result. Do you do an open procedure or a closed procedure? Do you use grafts or not? There's a lot of choices that can subtly influence the end result, and you really should know what those alternatives are, what the recovery will be, and what the potential risks are. It really comes down to getting a natural result, because every surgery is individualized, and being sure that your surgeon will in fact do that. It's difficult for the patients to reach that final decision. What we see frequently in our practices, people will go on the website, look at different surgeons, look at their results. That saves you a lot of time and money for consultations. I have people send me pictures from all over the country, in fact all over the world. So before I ever see them in consultation, we have at least an agreement as to what we will do, how we will do it, all that pending final examination at the time of consultation and preoperatively. So to summarize, really what you need is you need a board certified surgeon who rhinoplasty is one of his specialties. Find out about his or her practice. You want to get recommendations from medical schools, from medical societies, from physicians in your community. Follow your gut. That really helps. Don't be talked into anything. Have a surgeon who answers all of your questions, all of them thoroughly, and discusses advantages and disadvantages of different techniques. Finally, see his or her results, and a lot of them, because that will ensure that your aesthetics and your surgeon's aesthetics are compatible.